Hello and welcome to Health and Wellness. I'm Dr. Jennifer Ashton. May is National Stroke Awareness Month, and what many people don't know is that strokes can affect people of all ages and backgrounds. In fact, it's the third leading cause of death in the United States. So today we are joined by top New York City neurologist Dr. Carolyn Brockington and stroke survivor Sharon Grunhut. Thank you both so much for joining us.
Thanks for having us.
So Dr. Brockington, I want to start with you. First of all, strokes don't get a lot of attention in the media, unfortunately, and the public awareness of strokes is really not what it should be given the fact that it is the third leading cause of death in the U.S. Heart attacks and cancer, number 1 and 2 respectively, get all the attention. What do you think the public needs to know about strokes?
Well, the important thing to know about stroke is that it doesn't have to be a death sentence. It is true that some strokes can be very disabling, but other strokes can be relatively minor and people can go back to work and have their life, etc.
Go through with us, if you can, the various types of strokes, what they mean, and what people need to know if they've had one of those kinds of strokes.
Certainly. There are 2 different types of strokes. The majority are ischemic, which means a reduction in blood flow. Not enough blood gets to the brain and causes the injury to the brain. And 20% of the time it's called hemorrhagic. Hemorrhagic means blood. So bloody, essentially a blood vessel ruptures, allows blood to spill in the brain. So the interesting thing you know about the brain is that the left side of the brain takes care of the right side of the body and vice versa. So if someone has an injury on the left side of the brain, the symptoms are sudden, and they may have sudden weakness on one side, the face, the arm, and the leg. They may have sudden numbness. They may have problems speaking where they can't say the words they want or understand what people are saying to them. They may have difficulty with vision, seeing double. They may have difficulty walking as if they're drunk and they're not.
In heart attacks, we hear oftentimes there's a golden hour. In trauma, we hear there's a golden hour. What is it for a stroke?
The first 3 hours are the key hours because we can give certain medicines. We call them thrombolytics. Thrombus clot, lytics to break up, essentially clot busters to allow blood to get back to the brain. And so if someone comes in a day later, that's too late for us to really work on them. They have to come in within the first few hours.
Take us through some of the risk factors for both of those types of strokes, especially in younger people, because a fair amount of strokes actually occur under the age of 65. Most people think that strokes just occur in the elderly population, but what are some of the common risk factors?
Well, the number 1 risk factor for stroke is high blood pressure, or we also call it hypertension. So, and the reason is because if the pressure is very high in the blood vessels, it starts to wear them down over time. So either they close or they open, right, which is a bad choice either way. Another risk factor is diabetes. When someone has very high sugar or glucose in their blood, it sort of clogs up the arteries, clogs up the plumbing, so to speak. And so that causes a stroke. Elevated cholesterol, obesity, smoking, right? Smoking's bad all across the board. And then family history also is very important.
Now, I want to bring in Sharon.
Sure.
Sharon Grunhut, you had an unbelievable story. You yourself suffered a stroke 3 years ago, almost to the month.
Yes,
tell us about
stroke month.
Tell us about what happened to you.
Well, I was doing a lot of Pilates classes, and I stopped doing them one day because I had really severe headaches. And I noticed that my eye was drooping. Along with the headaches, I went to my doctor. Everybody who saw me said, "You're not having a stroke. You're wonderful. You're great. Not having a stroke."
Let's go through some of the questions. No family history.
No family history.
You didn't smoke.
I do not smoke.
You lived a healthy, active lifestyle,
I'm a vegetarian.
obviously.
I exercise.
No other medications, no high blood
Nothing.
pressure.
No pill.
So
Not
we
on
would
the
say,
pill.
Dr. Brockington, she was pretty much as low risk as you could be.
Exactly, yes. But that sort of highlights the importance because anyone can have a stroke. Yes, certain things increase your risk of having it. But really what Sharon had was an injury to her artery, which can happen to anyone, and we call that injury a dissection. Right. Essentially it means that instead of the blood going through the pipe, it dissects. It goes between 2 of the muscle layers of the artery, and it starts to close down the artery, so not enough blood gets to the brain, and she has a stroke.
And how are you today?
I'm perfect.
Perfect.
I'm perfect. Thanks to the doctors at Roosevelt Hospital.
She's better than perfect.
I can see that. And you really say, Sharon, not only that the message of your symptoms and how it was really missed by several medical professionals are so critical for people to know. But you also say that it really changed your whole outlook on life. What do you mean by that?
I thought having the stroke was the best experience I ever had, and I've had lovely experiences. I don't, I want to put that in sort of context that it was a remarkable experience for me because I was somebody who was always very much in control, or thought I was very in control. And when I had the stroke, I felt such relief that something so big and so beyond my control was happening that I could let go. And that letting go was such a pleasure.
So Sharon, in terms of your recovery, how long did it take from the actual stroke to when you felt you were back not only to your baseline, but beyond, better than that?
I would say 2.5 years to get to really where, but every day was progress.
It was physical therapy, occupational therapy, or what was?
I went home, and it was actually the best thing that ever happened because I live on my own and I had to figure everything out myself. And
so you were living your occupational therapy,
I thought it was
really
the best thing because I had no use of my right hand and I would make a sandwich and I thought I was carrying it into, to sit down to eat. And I would look and the sandwich would be on the floor and my hand would be like that, and that would happen so until I realized I have to use my eyes to teach my brain how to hold my hand in this manner.
You told us that you used to do handstands.
Yes.
In Pilates.
In
Are
yoga.
you back to doing any?
Okay. All right, so the doctors told me, no Pilates, no yoga, no bungee jumping, and no parachuting.
And probably no scuba diving.
Oh.
Yeah.
Oh.
But other than that, you're good.
That, really good.
have a
Really
full
good.
life.
That's right, clearly.
I won't be scuba diving either. So that's
Okay, nor will I anymore. Such great information, both from the patient standpoint and from the medical standpoint, and obviously so much that people need to know in terms of public awareness. I want to thank Sharon and Carolyn so much for joining us, and thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton, wishing you good health. Until next time.